our numbers were relatively low, meaning that it had dropped to about 800 or so. And then we start seeing an increase in those numbers of new cases. And that is very instructive because it's telling us that we probably have a more infectious variant that is now in Guyana.
That was Minister Anthony speaking to the recent surge in COVID-19 infections and hospitalizations in the country on Tuesday. According to the minister, these new recorded cases are predominantly among the unvaccinated.
Well, what I can say is the majority of people that we have in hospitals right now, almost all of them, are unvaccinated. So it makes a big difference. So if you're vaccinated, you probably would not be in the hospital.
In light of the continued vaccine hesitancy being portrayed among a fraction of the population, the minister lamented that most of the persons fueling the myths and confusion have already taken the vaccine themselves and as such are protected from the full wrath of the virus.
They're not representing your interests. They're representing their own selfish, whatever it is that they're trying to do. We shouldn't be caught up in that.
It was inevitable that the mutated, deadlier and more transmissible strain of COVID-19, the Alpha variant, would find its way to local shores since it has been wreaking havoc in Trinidad and Jamaica. The Alpha variant is credited with attacking youths and children, and unlike the original strain of the disease, having an existing underlying ailment is not a prerequisite for a person becoming seriously ill, hospitalized, or even dying. The Alpha variant has become the dominant strain in most countries around the world, and it would eventually reach Guyana. Cognizant of that, the Health Ministry says it has been working overtime to encourage and push for more persons, including children, to get vaccinated. This action, the minister posited, could save Guyana from the disastrous effects currently being encountered by many countries around the world, which are experiencing mass deaths and overflowing intensive care units. At present, there are 1,464 active COVID-19 cases in the country, while 90 patients are hospitalized. 22 of those patients are in the COVID intensive care units. Over the last week, a marked upsurge was noted in the number of daily new infections. Last Friday, a whopping 177 cases were recorded in 24 hours. Meanwhile, as it relates to the single-shot Johnson & Johnson vaccines, which should be in Guyana soon, the minister reiterated that it is primarily for residents in remote areas. However, a very limited amount will be available to other persons. And the Pfizer, which arrived on Tuesday, is just the first tranche to vaccinate the nation's children. More will be procured at a later date to ensure every adolescent is vaccinated once there is parental consent. Already, the Minister of Education has reported that over 1,000 consent forms were received by the ministry, signaling parents' approval to vaccinate their children. Students from 8 schools in Georgetown between the ages of 12 and 17 will be piloting the government's rollout of the Pfizer coronavirus vaccine administration, set to begin on Wednesday. Reporting for the HGP Nightly News, Kendell Richmond.